How to treat and cure SAE, Binswanger's disease. Binswanger's disease is a type of neurologic disorder. It is characterized by degeneration and lesions of the deep white matter of the brain. Binswanger's disease is a form of vascular dementia. Vascular dementia results when brain cells are deprived of oxygen. This causes brain cells to die. Binswanger's disease, BD, also called subcortical vascular dementia, is a type of dementia caused by widespread, microscopic areas of damage to the deep layers of white matter in the brain. The damage is the result of the thickening and narrowing, atherosclerosis, of arteries that feed the subcortical areas of the brain. Atherosclerosis, commonly known as hardening of the arteries, is a systemic process that affects blood vessels throughout the body. It begins late in the fourth decade of life and increases in severity with age. As the arteries become more and more narrowed, the blood supplied by those arteries decreases and brain tissue dies. A characteristic pattern of Binswanger's disease damage to brain tissue can be seen with modern brain imaging techniques such as CT scans or magnetic resonance imaging, MRI. Binswanger's disease occurs when cells of the white matter of the brain degenerate and/or die. This degeneration of the white matter is due to hardening of the blood vessels within the white matter of the brain, which results in a compromise of the blood supply to the brain in general. The white matter of the brain in particular. The exact cause of Binswanger's disease is unknown. However, factors that are believed to play a role in causing the disease include high blood pressure, but probably also blood pressure that is too low for proper brain blood supply. Cardiovascular disease. Hardening of blood vessels, atherosclerosis. Diabetes. Risk factors. A risk factor is something that increases your chances of getting a disease or condition. Binswanger's disease usually affects people over the age of 60. Other exact risk factors for the disease are unknown. However, factors that are believed to increase the risk of the disease include high blood pressure, cardiovascular disease, hardening of blood vessels, atherosclerosis, diabetes. Symptoms of Binswanger's disease. The symptoms associated with Binswanger's disease are related to the disruption of subcortical neural circuits that control what neuroscientists call executive cognitive functioning. Short-term memory. Organization. Mood. The regulation of attention. The ability to act or make decisions, and appropriate behavior. The most characteristic feature of Binswanger's disease is psychomotor slowness, an increase in the length of time it takes, for example, for the fingers to turn the thought of a letter into the shape of a letter on a piece of paper. Other symptoms include forgetfulness, but not as severe as the forgetfulness of Alzheimer's disease. Changes in speech. An unsteady gait. Clumsiness or frequent falls. Changes in personality or mood, most likely in the form of apathy, irritability, and depression, and urinary symptoms that aren't caused by urological disease. Treatment for Binswanger's disease. There is no specific course of treatment for Binswanger's disease. Treatment is symptomatic. People with depression or anxiety may require antidepressant medications. Recent drug trials with the drug memantine have shown improved cognition and stabilization of global functioning and behavior. The successful management of hypertension and diabetes can slow the progression of atherosclerosis, and subsequently slow the progress of Binswanger's disease. Because there is no cure, the best treatment is preventive, early in the adult years, by controlling risk factors such as hypertension, diabetes, and smoking. Prognosis for Binswanger's disease. Binswanger's disease is a progressive disease, there is no cure. Changes may be sudden or gradual and then progress in a stepwise manner. Binswanger's disease can often coexist with Alzheimer's disease. Behaviors that slow the progression of high blood pressure, diabetes, and atherosclerosis, such as eating a healthy diet and keeping healthy wake, sleep schedules, exercising, and not smoking or drinking too much alcohol, can also slow the progression of Binswanger's disease. The main symptoms of Binswanger's disease include progressive deterioration of intellectual abilities, cognitive and motor abilities, progressive memory loss, slow, unsteady gait. Other symptoms that may be present in people with this disease include incontinence, difficulty speaking, swallowing difficulties, paralysis of one side of the body, apathy, loss of interest in activities, inactivity, depression, Parkinson-like symptoms, including tremors, loss of coordination, loss of trunk mobility, seizures, strokes, confusion, paranoia, disorientation. Diagnosis: Binswanger's disease is a form of vascular dementia. Its symptoms can resemble other causes of dementia such as Alzheimer's disease. Your doctor will ask about your symptoms and medical history and perform a physical exam. Tests may include MRI scan, a test that uses magnetic waves to take pictures of your brain. CT scan, a type of X-ray that uses a computer to take pictures of your brain. SPECT, single photon emission computed tomography, a test to look for functional degeneration of the white matter in the brain. Treatment: there is no known cure for Binswanger's disease. Most patients die within 5–10 years after onset of the disease. Medications can be given to help limit or control symptoms and possibly slow progression of the disease. These include medications to control high blood pressure, heart arrhythmias, stroke risk, e.g., aspirin, increased cholesterol, antidepressant medications. Prevention: there are no definitive guidelines for the prevention of Binswanger's disease because the exact cause is unknown. However, the following may help reduce your risk. Don't smoke. If you smoke, quit. Eat a diet that is low in fat and low in salt. If you drink alcohol, do so only in moderation. Moderate alcohol intake is 2 drinks per day for men and 1 drink per day for women. Have your blood pressure and blood cholesterol levels checked regularly, at least once per year, and if treatment is recommended, follow your doctor's guidelines. Avoid low blood pressure. If you get dizzy when you stand up or have a history of fainting, be sure to talk with your doctor about ways to ensure a safe amount of blood circulation for your brain at all times.